Top story this morning, South Korea has reported its first suspected cases of the new COVID variant. It is called Omicron. In response, the South Korean government plans to tighten border controls, this coming as South Korea endures another spike in infections, with the daily caseload possibly hitting a new record when the finalized figures come out in a couple of hours from now.
For more on this, we have our Kim Yeon-seung in the studio with us. Good morning, Yeon-seung.
Good morning, Mo-kyun.
So Yeon-seung, let's start with the update on the COVID-19 situation here in the country.
Well, South Korea saw its highest late-night tally as of yet. Close to 3,900 cases were logged up to 9 p.m. Tuesday. When the total tally rounds up for Wednesday, it has the potential to mark a new record high. The daily caseload may reach way above that 4,000 mark. The peak in infections stands at 4,150 new cases, which was marked last Wednesday. So when the new tally comes out, it might be way above that mark.
Now, we have been reporting, like other news shows, that this Omicron has been popping up in many countries around the world, and we are hearing there may be, we must stress, may be suspected cases of this variant in South Korea now.
Exactly, Mark. Like you mentioned earlier, South Korea found its first suspected cases of Omicron within its borders. So South Korean health authorities said on Tuesday that a couple that had visited Nigeria tested positive with COVID-19, and officials have reason to suspect that this couple was infected with the Omicron strain because Canada and Hong Kong have also seen Omicron infections in travelers from Nigeria. Health authorities have found out that they had come into contact with and transmitted the virus to their teenage child and one of their acquaintances. So currently there are 4 people in South Korea who are suspected to have been infected with Omicron. The test results that determine whether they're infected with the strain or not will come out Wednesday night, sometime around 9 p.m.
So Yeon-seung, how is the country taking further steps to address this new threat?
Well, for starters, South Korea will tighten border controls. The Blue House on Tuesday said in a written statement that President Moon Jae-in had ordered officials to take the necessary steps in order to fend off this new strain because it has the potential to become a national health threat that can throw off the current COVID-19 prevention efforts. President Moon had ordered officials to strengthen prevention measures for incoming travelers, to quickly modify test kits so it can identify the Omicron variant, and to cooperate with international bodies and experts to discuss an apt response. Officials had not yet specified on how they plan to constrict entry for foreign travelers as of yet, but stay tuned to Arirang News and we'll bring the updates as soon as we can.
Yeah, we broadcast the news every couple of hours, but if we get some breaking news, we'll pop a computer graphic on the bottom of the screen for everyone to get the latest information. But tell us more about how this new variant is affecting other countries.
Well, health experts have, neighboring Japan also found their first case of Omicron as well. The infected patient was a Namibian diplomat arriving from his home country. With Omicron cases now spreading among the Asian populations, Chinese authorities are worried that this has the potential to thwart the upcoming Beijing Winter Olympics, which is due to kick off in 2 months. Israel also saw new infections among 2 doctors, both of whom had completed the 3-dose inoculations. In Europe, Omicron cases totaled 44, spanning over 11 countries in the region.
But Yeon-seung, why Europe? Why is Europe seeing a comparatively high number of Omicron infections and the spread of caseloads?
Well, health authorities have reason to suspect that this Omicron strain has been circulating around in that region earlier than suspected, and even before South Korea detected this new strain and alerted the WHO. So the Netherlands health body had traced this mutated virus strain among patient samples that date from November 19th to the November 23rd. Remember, South Africa sent warnings to the WHO on November 24th. So this variant could have been running rampant earlier and in more regions than health authorities previously have thought.
Right, and we have been getting some mixed messages about how serious this strain is. But do we have any new information that might give us a greater insight to what we are facing here?
Well, it's still too early to tell, but early tests do show that the current methods of treatment that we have available may be less effective against Omicron. So right now, the COVID-19 antibody drug cocktails from Regeneron and Eli Lilly are widely used for COVID-19 infected patients. But separate preliminary tests show the effectiveness of these cocktail drugs may be lessened when it comes to battling this new strain. Since these tests are preliminary, scientists are refraining from drawing up any conclusive statements from these studies. But if they do turn out to be true, current treatment methods may have to be modified.
Well, we certainly have to hope new treatments for this new variant could be developed soon. Anyway, thank you so much for your report, Yeon-seung. We'll talk to you again soon.